registered nurse here in Newport County, and we are talking about this past year of pandemic and civil unrest. And hi, Liz.
Hi, thank you for having me.
Can you talk to us a little bit about what this year has been like for a healthcare professional?
It has been challenging, and I think particularly for someone like me, I'm a new healthcare professional. I graduated from nursing school in December of 2019, and I started my first job at a nursing home the end of January, and pretty much COVID has defined my entire nursing career so far. So it's I think there's good and bad about being brand new. To some extent, we're not used to another way of doing things. So some of the new policies and procedures with regards to PPE and visitation, that's all I've ever known. But on the other hand, I don't have that sort of emotional resource built up from years and years and years of difficult situations. And so talking with veteran nurses, sometimes they'll say like, it's got to be tough to be brand new, because I think the emotional toll can be tougher just because I haven't been in it as long.
Are there particular things that happened while you were working at the nursing home that really stand out to your memory as you think about what you've experienced?
So we were very proactive there, and we were in regular communication with the Department of Health, and we had very strict policies and procedures for anyone coming into the building. And pretty much as soon as it must have started in mid-February, so I was still very new there, we stopped allowing visitors into the building, and that was a policy that really remained up until I left. I was there for about a year, and then just moved over to a hospital a couple months ago. So it was this policy designed to keep the residents safe. So what we had then was, visitors coming to the windows to visit through the glass. And this was a facility that previously there were no visitation hours. Family could come anytime, day or night, and took advantage of that. And then that was completely cut off. And so you now had them, coming to the glass, kind of peering through the window. And that was if you were lucky enough to be on the first floor of the facility. If you're on the second floor, it's really, Zoom, or there's a balcony, which in warmer weather, a resident can come out, kind of wave down, like Romeo and Juliet, but not nearly as beautiful. And it took a toll very early on. And especially we had, over half of our residents suffer from some form of dementia. And so any kind of change to routine can be very dangerous. And we had people really starting to kind of draw in on themselves and really had a failure to thrive. And I would say throughout the course of the year, we had a few people who really became very withdrawn, became nonverbal, stopped eating. And we did lose a couple people, and these are deaths that are directly related to COVID, and yet they will never be recorded as such. And I think that's a pattern throughout the country. But it was pretty awful to watch because you go into healthcare because you want to help people, and we were trying to keep everybody safe, and yet that safety came at a cost. And yet throughout, I kept saying, I'm very glad that I'm not making the rules here, because I think there are no easy answers. I think there are costs to keeping things more open, and there are costs to keeping things closed. And I think we did the best that we could with the information that we had. But that's one thing that definitely stands out, and a lot of soul searching for me. And then the other thing is that we had no cases from the beginning of COVID up until November. And we really thought we were doing something right as we watched all the nursing homes around us develop cases. And the reason it's so important to try and keep even a single case out is that for a nursing home, unlike a hospital, you don't have negative pressure rooms, and it's very communal living. Most people have a shared room. And so once it gets in the building, it's going to spread like wildfire, no matter what you do. And that's exactly what happened. So we had no cases for months and months and months. And then we had one case. And then within a couple of days, we had, I think, 4 or 6 cases. And in the end, all but one of the residents was infected with COVID, and well over half the staff. And what ensued was a pretty nightmarish month of just watching the residents get sick, the staff get sick, the kind of a skeleton crew of staff, some long days, and just feeling like it was kind of triage nursing. And that was tough.
Did you feel physically afraid for yourself when this was happening?
No, actually, at no point have I been afraid for myself. I mean, I'm a fairly young, healthy person, and we were provided with PPE. When I started initially wearing an N95 mask, I found it a little claustrophobic. And then we had to add a face shield to it. And I found, especially with the glasses, everything was always steaming up. But as soon as we got COVID in the building, I came to love both those pieces of equipment. And I actually, take my face shield home with me. And and I felt like that was my armor. And of course, it's not 100%. And given the fact that my glasses were steaming up, obviously I didn't have a perfect seal on it. But no, I was more afraid for my coworkers, some of whom had underlying health conditions, and definitely for the residents, because we were taking care of really the most vulnerable, elderly people with generally multiple comorbidities. And you feel this responsibility because the family can't get in. And so you are the one taking care of that loved one. And so I think the emotional stress was foremost in my mind. And again, truly, at no point was I, scared for myself. I was scared for the people around me.
You bring up something else, which is it seems that healthcare workers, particularly in nursing homes and hospitals, had to take on new roles during this, comforter and family substitute and bridge to family. Is there any incidents that you remember to talk about in that regard?
Well, what I always felt such gratitude for our amazing activities staff. I think they are some of the unsung heroes in nursing homes. And, we went from having a very robust schedule of kind of group activities, several times a day, to really them having to go. And this was even before we had COVID in the building. So this was even in the spring. Really, they started going like room to room and offering kind of one-on-one activities, which is in no way the same thing. But they were also one of the main, they were the people who really tried to bridge the gap with the families and did a lot of the video chats for the residents who didn't have maybe a smartphone or a tablet. And they did such an amazing job. But I remember one thing that stands out was Easter last year. I was working, and our director of activities dressed up like the Easter Bunny and came in. And I remember I started crying. I don't think I've ever had that kind of response to any kind of Easter tradition, but it was just the residents were so excited. And it was just this beautiful moment of happiness in this very dark, uncertain time, because, a year ago, we knew so much less than we did now. And it was, everyone was so on edge. And this was the first holiday that the residents had without being allowed to have families in the building. And that one stands out as just the Easter Bunny came in, and for a couple hours, everything was really great.
How are things different in a hospital setting for you now? And how are you feeling about where we are with everything?
Things are very different in the hospital. And in fact, I work on a COVID unit, and, a lot of my friends and family, when they found out about this job, they said, "Oh, all right, aren't you scared to be on the COVID unit?" And he said, "No, I mean, at the hospital, again, we have negative pressure rooms, which provide an added level of safety for the staff. I also, my PPE is even more extensive and full coverage than what I had at the nursing home. So my response to them was always, if I stayed safe in a setting where we just weren't prepared to deal with that kind of infectious disease, at the hospital, I feel even more protected. But of course, what we have at the hospital is that we have a higher acuity of patients who are infected with COVID. We were actually at the nursing home. Most of our cases ended up being very mild. There were only a few people who had complications and fewer still who had to go out to the hospital. So what I have now at the hospital is those people who were not able to stay at home or in a nursing home, and we're seeing them. And so I'm seeing that really sick side of COVID. And I remember I think it was my second day of orientation. And I remember being in a room and someone was on a medication called remdesivir, which you hear about all the time on the news. And I actually had this kind of moment of excitement, like, oh my God, this is like what I see on TV. I'm doing that COVID nursing. So, what I can say is even in the couple of months that I've been there, our number of COVID cases have definitely gone down. And in fact, right now we have just a couple of cases on the floor, which is great. But I think we're all bracing ourselves because it seems like that third wave is very much a reality in Europe. And from my own perspective, I think we're getting pretty lax around here. I think people are tired, which is understandable. It's been a long year, but I think people are not taking the same care that they were even just a couple of short months ago. And of course, not everyone is vaccinated yet. And then we also have a lot of people who don't want to get vaccinated. And so I am very nervous about the future, because especially if we don't get a handle on this, as these new, stronger, more resistant strains come in, they're really going to be able to get a foothold. And I think we're at this pivotal point where our actions in the present can carry huge consequences for the future of this disease. And as tired as people are, if we can just hold in there a little bit longer, we'll really be able to open up in the end. But my concern is that we're just going to continue to maybe do the easy thing or the selfish thing, and it's going to make this thing last a lot longer. And there's so much bad information out there. I have been helping out for the last couple of months at vaccine clinics, some that are run through the state at like local community centers, and now I've also helped out at the hospital. And as wonderful as it is to see people coming in, you get even the people who do come in, a lot of them have questions about the vaccine that are, just a lot of really bad information, but at least they're willing to come in and, sit and talk with us and get some other information so that they can make an informed decision. But there are so many people who are not coming in at all, not even, willing to kind of consider talking with a healthcare provider or a nurse. And, I'm worried about that. I think I heard something on NPR recently about we all know someone in our family who doesn't want to get vaccinated, and that you tally that all together, it's going to be really hard to get to that 85% herd immunity. And I'd say I know quite a few people who are not planning to get vaccinated.
What are you hearing that they're worried about when they come in?
That it's going to change your DNA is one. I had somebody yesterday who was concerned that it would lead to fertility issues. Some people are scared if they've had an allergic reaction to a vaccine in the past, and that is absolutely a legitimate concern. And in fact, at the hospital, there is a high-risk vaccination clinic that they actually offer for people who have had any kind of adverse reaction in the past, and it's in the ER, but that, doesn't make it any less scary. Let's see, what else have I had? That the vaccine has been adulterated somehow, that there's going to be a microchip allowing the government to track you. That seems to be what
and in your wisdom as a healthcare professional, none of those things are true, correct?
I would say none of those things are true. No. yes, this, well, and to people who say, that I guess another concern is that it was developed so quickly. Well, in fact, they were actually working on the science behind this for about a decade. And they just needed something to come along that they could actually then implement that knowledge. So it's a new vaccine, but it isn't, in the case of the science behind the Pfizer and Moderna. But again, what I tell people is, what I can tell you, what when people ask me, what about, side effects? Because that's, I think, another concern. And especially if someone has, a sore arm after the first one, they're really nervous about the second one. I think it's just sort of permeated the conversations that most people have a strong reaction to the second one and feel kind of crummy for anywhere between 12 to 24 hours. And I think people are scared about that. But what I will say to them is, I can almost guarantee you your arm's going to be sore after the first one, and after the second one it seems like well over half of people have low grade fever, muscle aches, joint pain, but it lasts in most cases well less than a day. And you compare that with COVID, which can last weeks or months for some people, and of course lead to death. And I'll say, having worked on the floor and seen this firsthand, I would take that day of feeling crummy any day. It's so, worth it. So I think so far I haven't had anyone leave without getting a vaccine. I think in
Well
the end
done.
we're able to talk through it. But I always say to them, I don't want you to feel pressure. I don't want that, because that again makes me feel icky. I want this to be an informed decision and something that someone feels comfortable about. But I think again it's important to have that dialogue, and for me to not approach them mockingly at all, because you come in and you're feeling very vulnerable, and people tend to be afraid of needles and shots anyway, and it's just been a very scary time. So I think sitting down right across from them and just saying, okay, what are you nervous about? Let's talk about this. And I think that's huge, rather than you're being silly, give me your arm. Never going to do
Yeah,
that.
and I
Mm-hmm.
find that question, what are you worried about? Talk to me about
Mm-hmm.
what you're worried about. Is the
Mm-hmm.
question maybe we're not asking each other enough.
Mm-hmm. Mm-hmm.
My question to you is, do you feel that we as a county or as a society, a state, any level you'd like to go, have learned some things about ourselves and about our culture and our moment that maybe might want us to behave a little differently going forward? That the goal here isn't necessarily to just return to the old normal, but
Mm-hmm.
maybe to have learned something going
Mm-hmm.
forward.
Yeah, and it's an interesting question for me, because again, I don't really have a before COVID to compare to, or even a before the Black Lives Matter protests of the last year. What I will say is our conversations daily at the hospital, we are oftentimes talking about health disparities for our patients. And of course, what a lot of people don't know is that Newport is actually a very poor community. We have a lot of low income people, with a lot of health disparities related to that we are seeing at the hospital, and they're some of our regular visitors. So again, we talk about that a lot. And what I have wondered, and I've not asked my colleagues, is this something we've always been aware of, or is this something that has come to the forefront in the last year? And I just don't know. I mean, I personally I'm glad to hear us having these conversations and starting to address it. As always, demand far outstrips supply, whether it's having the enough shelters or enough rehab facilities. We oftentimes have people who are staying with us for a very long time, just waiting for a bed to open up at another facility, and that's not ideal. And so I can feel that it depends on the day. I think sometimes I feel very depressed thinking about how behind we are in meeting the needs of a lot of our patients. And it's not for lack of trying. They're just, that we don't have the facilities in our local community, but I think most communities are like that. But the fact that we're having these conversations, and I think more aware, that's important, very important. With regards to COVID, I think the last year has shown us the best and worst of ourselves, as I think crisis always does. And I would like to think that going forward, we're going to be more global in our thinking, but I don't think that's really what I've seen the last year. I think it's been a lot of, nation against nation, certainly a lot of racism towards people of Asian descent, a lot of, um, people thinking about themselves and, well, the mask is uncomfortable, I'm not going to wear it when I go out to the grocery store, as opposed to thinking about your neighbors. So there, I'd like to think of myself as an optimist, but this last year has really made me feel pretty pessimistic about a lot of my uh, fellow Americans. But again, I think what I'm going to focus on is that those conversations that we're finally having about health disparities, and then that maybe that's going to be something where we can make some real positive change. We want to have healthcare professionals who represent the community. And even though my nursing program was very, very diverse, at my hospital, I would say most people look like me, and we're definitely not representative of our patient population. So I think that's a place where we, and I hopefully will also, hiring practices going forward, be aware of that need for diversity in all its many forms. That's very important.